Administering oxygen by mask. When a patient's higher concentration of oxygen than a nasal cannula can deliver, use an oxygen mask. Fit the mask carefully to the patient's face to avoid leakage of oxygen. Assessment. Assess patient's oxygen saturation level before starting oxygen therapy to provide a baseline for determining the effectiveness of therapy. Assess patient's respiratory status, including respiratory rate and depth lung sounds. Outcome identification. The expected outcome is that the patient exhibit an oxygen saturation level within acceptable parameters. Nursing diagnosis: impaired gas exchange, ineffective airway clearance, respiratory intolerance, excessive fluid volume, and decreased cardiac output. Evaluation: expected outcome is met when the patient exhibits an oxygen saturation level within acceptable parameters. Documentation: document type of mask use, amount of oxygen use, oxygen saturation level, lung sound, and rate pattern of respiration. Bringing everything to the bedside conserves time and energy. Arranging the item nearby convenience save time and avoid unnecessary stretching and twisting of muscle of the part of the nurse. Hand hygiene and PPE prevent the spread of microorganisms. If it's required, based on transmission, good caution. So identify the patient to ensure the right patient receives push. Ensure the intervention and help prevent errors. Good morning, sir. So I will be your nurse for today. So I'm the one who assists for the math for administration. So what is your name, sir?
Mujahid.
Okay, so I'm going to proceed for the administration. So you're going to close the doors and curtains to ensure the patient's privacy. Oxygen forced through the water reservoir and humidifier before their delivery to the patient. Those prevent dehydration of the mucous membrane. Reservoir's bag must be inflated with oxygen because the bag is the oxygen supply source for the patient. So a loose or poorly fitting mask will result in oxygen loss and decreased therapeutic value. Mask may cause a feeling of suffocation, and the patient needs for frequent attention and reassurance. For the use in oxygen, either going to use a mask or nasal cannula. So for the nasal cannula, we're going to put this to nose and through to the ears. So this to the both ears, and this for adjust if for the safety of patient. Adjust this for adjustment. For not suffocate for the patient. So after that, this is the way for using nasal oxygen by nasal cannula. So pads reduce irritation pressure and protect the skin of the patient. So it's either you're going to put in a pad or use a gauze pad under the elastic strap. So this helps assess the effectiveness of oxygen therapy. Removing PPE properly reduces the risk for infection transmission and contamination of other items. So hand hygiene prevents the spread of microorganisms. The tighten fitting mask and moisture from condensation. can irritate the skin of the face. There's no danger of inhaling powder if the placed on the mask. So it's 2 to 3 hours if the oxygen is running continuously. So do not use the powder around the mask.